Okay.
Okay, so first I want to say this before I forget.
Okay. Should
That
I
I'm
be
here with
talking?
Master Sam Naples. And you can look better here. I just want to, if you have a website, I wanted you to give that.
Sure. It's www.mastersamnaples, all one word, hyphen NLP, that's Neuro-Linguistic Programming, NLP hyphen hypnotherapy.com. So all one big word. But if you type in Master Sam Naples, it comes up in the first couple Google searches. And you'll also get my Facebook page, and you'll also get my blog. So any one of those will then direct you to my website.
Okay, wonderful.
Yeah.
Okay, first, I just want to know, like, how long have you lived in this area?
My whole life, so more than 25 years.
And my first question is, what made you go into martial arts aside from the hypnotherapy?
I was 12 years old, and I was afraid of being bullied. I mean, I was like really, really overweight, so I don't think I was ever really bullied, but I was just a coward. And I wanted it to feel like I could stand up for myself. And so, then I read the comic books, get sand kicked in your face and defend yourself. And, I wanted to buy those books, but I never did. And then went to a drugstore, and there was a black belt magazine, and I saw the black belt magazine and started reading it, and got me more interested. And then there were a couple bookstores in downtown Youngstown that sold martial arts books, so I bought a few of those, and I was playing by myself. And then a bunch of friends of mine joined the YMCA when I was in 7th grade, and so I joined the Y with them, and then they all stopped going. And they had a karate class, a taekwondo class, and they had a judo class. And so because I was chunky, I thought I want to do judo, because being a big chunky guy is, being heavy is an advantage in judo, but you had to be 16 to do judo, and you could take karate at any age. So I went and said, well, I'll get my black belt and then I'll switch. And met Master Chan, and from then on it was just,
Wow.
yeah.
Let me check something. Go ahead. I just gotta keep talking. So, then you went as far as to go into your black belt?
I'm a 7th degree black belt.
Wow.
Yeah. I did it up until, from the time I was 12, I think that was like 1969 or 70 I started. And I continued to train up until 2005, when my back got so bad that I couldn't train anymore. And it also wasn't fun to just sit on the side of the room in a chair, and somebody does something wrong and you can't even walk over there and show them how to do it right. You just
How did you hurt your back?
I was 21 years old, practicing all alone, threw a kick, felt a muscle pull. No big deal, happens all the time. Got worse and worse and worse, and now, I don't know if you can see or the camera can see, but this foot is about 1.5 inches or 2 shorter than this one. And it's because, like, the bones are just all, out of whack. But so that's the original injury. Wow. And everything else has come from, that's changed since I got hurt. It wasn't like that when I got hurt. So.
Yeah, it's just, it progressed to that. Wow. So I didn't realize, like, karate could.
I didn't know that. Actually, I really believe, back a step. With my right leg, I could throw my foot sideways 180 degrees and hold it. And I could jump up and kick a basketball net. I was an elite athlete. Worked out 6-7 hours a day, trained 7 days a week. And I trained every day but Sunday, and Sunday we would go in the park and run like 10 miles. So, totally a jock. But with my left leg, I could only kick shoulder high, and when I would kick, it would drop. And so when you're competing in particularly like form competition, there's no way you can win if you can't, at least hold a leg right. So I was working on my left leg, and that's when I felt the groin pull. With the right leg, though, I was like, could do full splits both sides, almost all the way down with a middle split. Spread your feet. I put my belly on the ground and put my arms over my elbows, and whatever. So I was, like I say, an elite athlete.
And there was nothing they could do?
Well, it always felt like there wasn't something right. Like, you know, like I'd be working out and in the middle of workout.
You mean
like,
after the kick?
No, I mean, like, even like before I got hurt, like I'd be working out in the middle of a workout, I'd have to like bend over and stretch out my back a little bit, and you know, like kind of thing that you just do and don't think about. But in retrospect, I wonder, well, maybe that's really where this came from, is maybe something that I had to keep like cracking is really what ultimately caused this injury, so. Yeah.
And so then from there, what interested you in hypnotherapy?
Well, you know what? I got involved in a business organization that, well, another step back. I was teaching martial arts. I was on 224, and I was teaching pretty much the most successful elite names in our community. You know, I was really blessed to, you know, to meet all these people. And so, I mean, anybody that, you know, in the community you could think of that was successful, they or their kids were coming to me. And I can't pay my bills. And so, you know, one night I remember I was sitting there and I was thinking, maybe I should just ask somebody for a job and teach karate in a church basement 2 nights a week for a hobby, you know, because, you know, I can't live this way. And in the mail, I got a magazine, business magazine, you know, like first time. And so I went to a seminar. And so one of the things I noticed was that all of the really successful school owners had done Tony Robbins. And Tony Robbins is neuro-linguistic programming. Now the camera can't see it, but that's a picture of me and Tony Robbins. And at one of his events, it's called Life Mastery. They have a day called Contribution Day. It's a 10-day event. And where you go, everybody does something to give back to the community. And so they'll paint a fence or paint a hospital, like a ward or something or whatever. And, well, there are people from all over the world there. There were like 2,400 people there. And a lot of people bring their kids, and they have a kids camp. So on Contribution Day, I went and taught a karate class and had all the kids break boards. And so there's a picture of me in my Taekwondo uniform with Tony Robbins on the wall over there. And Tony Robbins does neuro-linguistic programming. And so I was into it from then, and I bought a bunch of books, but I didn't know that you could study with the guy that invented it. And then somewhere down the road, I found out that you could, and they taught every, you know, practitioner program every summer in Orlando. So I went in 2007 or 8 and got licensed as a practitioner, and then master practitioner after that, and then licensed trainer the following year. So
what? When you're hypnotizing people, I mean, is it, do you have to do so many sessions, like, to make progress with somebody? I mean, do they come to you with like a specific problem usually?
I'll tell you what, it's hit or miss. Well, you know, first of all, I am not hypnotizing you. Okay, so I want to qualify that. And because I asked you that a few days ago and you said that you didn't want to do that. So I will not do that. Okay, so just as, and it's on film, so, right.
Yeah.
Okay, so what I wanted to do is kind of explain how this works. Now, the fundamental principle of neuro-linguistic programming is that you can do more good to help somebody by dealing with the process of how their mind works rather than the content of their memory, right? And so, you know, I have a psychology degree. I went back to YSU and I graduated in '09. But in all my psychology classes, nobody ever explained what thinking is. And thinking is seeing pictures in your mind and talking to yourself. And we do both. We see a picture, then we say something, then we see another picture, then we say something, right? And so in neuro-linguistic programming, the process of seeing pictures and talking to yourself is called strategies. And so the hardest part of this, and it depends on the issue, is finding out what the person's limiting strategy is. And once we really ferret out what the limiting strategy is, it's easy to fix. And so sometimes, you know, the first time they sit down, we're right on and we're done. And sometimes it takes 3 or 4 sessions. I worked with a young lady, and she was a free case study, so I'm allowed to talk about it because normally I hold client confidentiality. Yeah. But that was, you know, she did it purposely, knowing that I would talk about it. She had test anxiety, and it took 3 or 4 sessions till we really got to the issue. And I'll come back to that in a second. But I wanted to kind of give you an idea of what I do, or how NLP works. So what I'd like you to do is just remember a time in the past when you were really, really happy.
Okay.
Just a specific event though, right? A specific, could be a birthday party, special dinner, you know, whatever.
It's horrible. Like I consider myself real happy, and I'm like,
Yeah.
I can't think of like
You
a
know what?
specific.
People tend to like try to look for a landmark thing. It's like, you know, you asked for a, you know, hamburger and they sent you out a prime rib or something. I mean, it doesn't have to be a life-changing event.
Can it be like where I'm just having a conversation with somebody and I'm laughing, like
Sure,
specific?
sure,
Okay,
okay,
all right.
great. So yeah, you have that specific memory.
Yeah.
Now, in that memory, is the memory black and white or color?
I don't know.
Look at it. You were looking at
I'm
it.
looking. Okay.
Yeah.
See, that's what I was going to ask you about picture, because I didn't. I did. I think I had a vision of the person that I was talking to.
Right.
But I honestly don't. I guess I think it was color.
Okay. Are you in the picture with them, or is it just them?
No, it was just them.
Okay. That's called disassociated. Disassociated, or no, that's called associated.
Okay.
When you're associated, you don't see yourself because you're talking to them. When you're disassociated, you see yourself in the picture talking, so you would see you and them, and so that just makes a difference.
Okay, right.
And usually when we have really strong feelings, we're associated. Not
Okay.
always, but usually,
Okay.
right? So that makes sense. This is you have good feelings, and so you're in it. And so, is it color? You said?
Well, no, I wasn't in it.
Oh, yeah, right. You weren't in it, right?
Yeah,
and,
right.
and is it color?
I think it was color,
Okay.
and that's what I was gonna. That's what I was gonna
Just
get back
trust
to
your
you
instinct.
about that.
When you-
Yeah.
Right, but most of the time, your first instinct is right.
Yeah, I think it was color. Yeah.
And is it a movie or a still picture?
No, it was just still.
Okay.
Yeah.
And how far away was it? When the memory?
The memory.
Right.
It was really recent.
But no, I mean, in your mind,
Oh.
is the picture like
In my
right in
mind.
front of your face, or is it
Oh.
a foot away or 2
No,
feet
I
away?
could. No,
Just-
it would be.
Just get a sense of it.
Yeah, right. Very close. Yeah.
Okay. Like, give me a
Of the
foot,
picture.
a foot, 2
I was
feet.
like-
How far away is it? Yeah.
It's more. It's just like in my mind, so there's no distance in that way. Do you know what I mean?
Yeah, but there is.
And I don't know. It's like
Okay.
it popped into my head, but I can't.
Okay.
Like I didn't see it floating outside of my head. Do you know what I mean?
Okay.
So,
See, the outside of your head is inside your head, though.
right.
Okay.
So
But okay, I'll tell you part of what I'm
been
doing.
close, I
Right.
guess. Is all.
NLP discovered this, and it's been perverted and polluted and confused since then. They use it on the mentalist sometimes, and there was a show called Liar Liar and whatever, but what they discovered in NLP back in the 70s was that, assuming you're right-handed, and it's reversed if you're left-handed, if your eyes go up to the left, you're seeing an image that you saw in the past. If your eyes go lateral to the left, you're hearing something that you heard in the past. It's a memory.
Okay.
If your eyes go up to the right, you're constructing an image. So, you know, if I said, visualize a lime green dinosaur riding a red Schwinn bicycle in an orange tutu playing the xylophone, right? Your eyes go to the right to construct that
Or
image.
they should.
Right. Your eyes go laterally to the right if you're constructing something that you want, so auditorily. So if you were writing music,
Okay.
your eyes would be going laterally to the right. And what's happening is when they go to the left, it's right brain function. When they go to the right, it's left brain function,
Okay.
right? And if your eyes go down to the left, you're talking to yourself. If your eyes go down to the right, you're feeling something. So someone comes in and says, I'm depressed. A therapist or a psychologist is going to ask you, why are you depressed? What depresses you? I don't care what depresses you, right? That's great because I can be a jerk, right? So I'm depressed. I don't care. Yeah. So now, but yeah. But what I want to know is how do you get depressed?
Yeah.
Which is, so somebody will come in, and I'm going to take off my glasses just for the sake of this. So somebody comes in and says, I'm depressed. And, you know, I ask them, how do you get depressed? And they go, I don't know, I'm just depressed. Well, they saw an image, then they heard something, then they said something to themselves, and that created the feeling.
Is that reversed for left and right hand?
Yes, I said that at the beginning, right?
Oh my god.
Yeah, it's reversed.
I
So
never be able to keep track of that if I'm looking at somebody.
So, but so, and the other thing is that when somebody is seeing pictures, and I talk really fast, when somebody talks really fast, it's because they're seeing pictures. That's, yeah, visual speaking is really, really fast. It's because the images are moving so quick in your mind that you're trying to keep up with them.
Yeah, what do you mean like the image, and what did you say initially was image and?
Thinking is talking to yourself or seeing pictures.
Talking or seeing pictures?
Right, and it's usually a combination of you'll see something, you'll say something, you'll see something, right.
I mean, what, you'll see an image in your mind?
Right.
It's like this is the thought process, you're saying?
That everybody's thought process, yeah, that's
Yeah.
what thinking is, right? And so, and every feeling comes because of a thought, or because of something you said or something you saw. You don't just have a feeling without some image or something you heard in your mind first.
So blind people would just be what they thought.
They still have images.
Or felt.
Right.
They still have images?
Sure.
Really?
I don't know, I just said that. It makes sense, I think they have images, I think
Well,
I
but
did
you
make-
said it could be
yeah.
thought or image,
Yeah,
so.
right. Yeah, but that's what thinking is it's, you know, it seems to me that even if they can't see because the organ is damaged, they still would have left brain function, so their brain would still imagine what something's going to, right? And, you know, a blind person that's touching somebody's face, you would
Yeah.
think they're creating an image of what
Right.
they look like. But I don't know that honestly, you know.
Right.
And I do lie a lot, so, you know, and don't trust everything I say, but.
Yeah, the honesty, you know, that's refreshing, you know.
Yeah.
I think in a hypnotherapist especially. But, okay, so what's the majority of people? Do the majority of people come to you? Is it all different at a lot of times?
It's a lot of different, and it seems to go in cycles. Like in the fall, I had a lot of people coming for allergies. Now, I qualify this.
How would that help?
Okay, well, you know, I tell people, you know, it's like, you have to be careful because allergies can be life-threatening. So you don't screw around with it. But in our continuing education class, I learned about this. And they use this process, they would do a blood test, and they were allergic to bees, and then they would do the process, and then they would do the blood test immediately after, and they no longer were allergic to bees.
After the hypnotherapy session?
Right,
Yeah.
and so, for example, like what we were doing, okay, with the good memory and blah, blah, blah. If I asked you, and we're not gonna do it I did this once with a lady, and I said, I want you to think of an unhappy memory, but just make it something that, like, you know, you ordered a salad with chicken on it and it came without chicken, not like life-threatening, you know, right?
Right.
And I was explaining it to her, and this was actually in a business setting, right? So, you know, because everybody wants to know what I do. So all of a sudden, she starts sobbing. She goes, I'm thinking about my divorce, and she'd been divorced for 15 years. And so that's kind of where her mind went. But so I say, but if you did the same thing that we did with this good memory, right, the image would be in a different place in your mind. Like if you think about your desktop, right, you got icons up in the top left corner and icons in the bottom right corner and icons all over the place. Well, your brain does that with images. So like happy images tend to be in one place, unhappy images tend to be in another place, right? So if somebody, say, is allergic to peanuts, okay, so the first thing we do is we have them just think about what it feels like when they, you know, if they were to come in contact with peanuts, just a little bit, and we stop them. Then we say, okay, now put an imaginary plexiglass window between, you know, in front of you. And then I want you to imagine yourself, you know, do you have an allergic reaction to almonds? No. Well, see yourself eating almonds. What about walnuts? No. See yourself eating walnuts. And so the belief is that the allergic reaction to peanuts is a mistake that your autoimmune system is making. Because peanuts are really not, you know, kryptonite, right? They're just peanuts. But your immune system is overreacting. And so you have them, you have them see themselves, you know, eating almonds, and you find out where is the picture, and is it black and white or color? Is it a still picture or a movie? Does it have a border or no border? How far or close is it from them? What's the location? And those are called submodalities, all the nuances that make the picture, you know, specific, right? Is it three-dimensional or two-dimensional? Are you in it or are you looking through your eyes, right? Associated, disassociated. So we find out all the nuances of like them eating an almond. Then we have them remember the time when they went into shock, and we move the picture over to the other location.
Wow.
And we make it identical. So this one might be black and white and this one's color, so we make it color. This one might have a border and this one doesn't, so we put a border around it. And we do all the nuances until the peanut picture is identical. And most often they will say, I can eat the peanuts and not go into shock.
Wow.
Because we've done that. So then after, they say, yeah, I'm eating peanuts, I'm not going into shock, we take away the glass window and have them reach up and pull that picture into their body. And magic.
Wow.
And so, and I would, like I say, I only do this with a doctor knowing that I'm doing it and doctor's blessing.
Like seasonal allergies too?
Yeah, sure, exactly. That's the theory, is that all allergies are just your immune system like freaking out. And so if you can teach it see, one of the principles of NLP is that everything your unconscious mind does is for a positive outcome. Except sometimes there are negative side effects, right? The guy that's smoking a cigarette is getting emotional benefits, right? The person that's like a chocolate addict is getting emotional benefits from it. Except they're also getting emphysema, or they're got weight issues or whatever. So, so our idea is to say, how can we keep the benefit and lose the cigarette? Because it's the benefit we want, not the cigarette.
Yeah.
It's the benefit, not the chocolate.
What do you replace it with?
Well, we tend to let the unconscious mind determine that. And before I do the allergy process, and I would say 80% of the time, I never do that process I just explained. There's a process, an NLP process called the 6-step reframe. And basically what you do is you say, I want to talk to your unconscious mind. And you say, I want to thank you for doing the great job of protecting Julie by giving her this peanut allergy, or blah, 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 right? So you go through and you thank the unconscious mind for taking care of the person. Then you say, the benefit that you're giving her is really, really valuable. But there's also this disturbing, side effect that really bothers the person. So if we could come up with alternatives that would allow you to get the same benefit, but without the disturbing, side effects, would you be willing to do that? And you get the unconscious mind to say yes. And usually you have it's called an ideomotor movement, but you'll ask the unconscious mind to signal you, and their finger will go like this. Or their eyes are closed, or they'll flutter, eyes are flutter, or they'll blink, or something. But you got to move signal, and then I ask the unconscious, would you give me that signal again to make sure I've got it? And if you get the same signal immediately, then you know that you're in rapport. And if not, then we just keep working until we're getting signals. Then you say, okay, I would like the creative part of Julie or whoever. I would like the creative part of the person. I'd like to speak to the creative part, and you get permission to speak to the creative part. You say, could you come up with 100 alternatives, some of them that are not as good and some of them that might be a lot better? And you get the creative part to say yes, and then you tell the unconscious, can you pick some of these and try them? And you get a yes, and you say, go ahead and do it. And the unconscious mind just does it. And in 80% of the time, that's all there is. That's called a content.
And then the person will tell you?
Well, sometimes and sometimes not. Sometimes consciously they have no recollection. Like the same thing when you ask what's the benefit. Sometimes there's no benefit. They don't know. They don't hear anything. And other times they'll hear in the back of their head, they'll say, so you're special. Or so, so you would get more attention, or whatever it was. So, but that's called a content-free process. And that's one of the things that I really like about NLP, and the type, when I do hypnosis, the type that we use, is because I think it's really intrusive for somebody to go into your mind and like poke around and tell your unconscious mind to do stuff. And so NLP believes that your unconscious mind is doing everything for a positive outcome. And so all we ask is, if you're making a mistake, could you fix it?
Yeah.
Go. And in fact, I worked with a woman that had a weight issue. And I hypnotized her, and I said, I want to speak to your unconscious. And I said, is there some benefit that you're getting from this weight issue? And she giggled And I said, what's so funny? And she says, yes, there's a benefit. And I said, what's the benefit? And she giggled again. And I said, what's going on? And she didn't talk for a little bit, and then she goes, I don't remember. And her unconscious mind didn't remember why she was overeating, but it was for something good. So I said, well, being that you don't remember, could you let her stop overeating, knowing that if you ever need whatever that benefit is, you can always go back to it or come up with other alternatives. And her unconscious went, sure. And she miraculously, like in a couple months, lost like 30 pounds without really changing anything.
Wow.
Just because, the unconscious mind didn't remember why.
Oh my God. How do you get, and I imagine there's going to be a percentage of people that you can hypnotize and then certain ones that you can't, but how do you get people to that state? There's a process of where they're in a state where you...
People are in trance 80% of the time.
They're in trance.
All day long, right? And it's like when you're at your desk, when you're on your word processor, when you're listening to music and alone in a chair in your living room, that's all trance. In fact, one of my teachers says that if you want your kid to do something, go sit down next to them on the couch while they're playing video games and start like just quietly saying, "You need to clean your room," and whatever. They said they're in trance and they'll just go, oh, "Okay, clean my room," right? And it's kind of a joke, but it's like it's much harder to get people to wake up and be present in the moment than to be in trance. They're in trance all the time, and because. And that's why it's like trance versus hypnosis. When you're like in that image, right, and you're seeing that person and you're feeling good and you're right, that's trance. It's not something bizarre. I don't have to hypnotize you. All you have to do is remember something and you're there.
But do people remember what you talk to them about when they're...
Sometimes yes, not always. Yeah. And it doesn't matter. That's kind of a thing where if the unconscious mind wants to, then they remember, and if it doesn't, they don't.
And how long does it normally take you through these steps to get somebody to reach their...
Again, it depends on what the issue is. Most of the time, you can hypnotize somebody really quickly. And there's also a process that's called fractionation, which, means every time I hypnotize you, you tend to go a little bit deeper than the previous time. And so with fractionation, it's like sometimes, the third or the fourth time is when you really get them to the right place.
And can you tell that then, like the different levels of somebody?
Usually by, how subtle their breathing gets really slow. But I mean, it depends exactly what we're doing, because like in some situations, I don't want them to be in a deep trance because we need to interact.
Yeah.
And like I did a process, there's a program I do called The Journey. And the Journey method is a program for cellular healing. And the woman that developed The Journey was an NLP master practitioner and a hypnotherapist. She developed a tumor the size of a basketball and accidentally healed herself. But then she looked at what was the strategy that healed this tumor. And she developed a way to teach people to use the same strategy. So that became known as the Journey method, and I studied with her a lot. But that was actually before I got into NLP. But
I just talked to some guy, I don't know if this is similar. And he said that something about he was reading a book where your brain can actually change the cell structure in your body.
That's exactly.
And I don't know if that was, but it was weird because this is the second time I've heard this in like a week and a half.
There's a book called Epigenetics that was written by, and I don't remember the guy's name right now. He also wrote the book, Bruce Lipton, The Biology of Belief. And epigenetics means above genetics, and it's the idea that your thought can change your DNA.
Wow.
And in fact, I used this study actually in YSU a few times, like for reports I had to give or whatever, but Dean Ornish, who had written a book in the 70s or 80s, it was all about nutrition and holistic lifestyle. And I think his book was called Heart Disease Can Be Reversed.
Wow.
But he did a study at the University of San Francisco, and just Google Dean Ornish prostate cancer and this stuff comes up. But in conjunction with the medical center, they got, I believe, the the details may be hazy, but the point is there. They got about 50 guys that all had prostate cancer. And they put them in this program, and they put them on a vegan food regimen. They did yoga 3 days a week. They meditated every day, and they went to group therapy once a week. One guy dropped out, one guy had surgery, and 48 of them no longer had cancer. Now, I don't know the time frame, I don't remember that.